Assalamu alaikum, ladies and gentlemen. My name is Ramla Qureshi. I am the CEO and founder of Women Engineers Pakistan. We are an organization that catalyzes the participation of Pakistani women in science, technology, engineering, maths, and medicine throughout the country and also abroad. We work with, high schools and undergraduate students in universities, as well as advocating for safer workplaces for women in professional areas, as well as advocacy for retention based policies for women in these specific fields. Today, though, we have the honor of having a very special guest with us. As you all must know, that October is very sensitive to women across the globe, as this is potentially seen as a breast cancer awareness month. As it happens, breast cancer is still not a household conversation in Pakistan, and we are here to solve that issue. So, help me in welcoming Dr. Sadaf Ishaque with us. This session for today, by the way, is in partnership with the Chughtai Lab. So let me introduce our very esteemed guest for today. Dr. Sadaf Ishaque is a fellowship-trained breast and general surgeon at the assistant professor level, and she joined Shalimar Medical and Dental College in 2015. Dr. Sadaf practices at the Chughtai Center, the Horizon Hospital, as well as Farooq Hospital. She is also heading the one-stop breast clinic at Chughtai Jail Road Center and Shalimar Hospital. Dr. Sadaf specializes in all aspects of breast health and surgical management of complex breast diseases. Her extensive knowledge of novel and up-to-date treatment modalities for breast cancer is an asset to her practice as well as her patients. Welcome, Dr. Sadaf. क्या हाल है आपका?
Well, मैं बिल्कुल ठीक. Thank you for the introduction and thank you for being on this awesome community.
Absolutely, absolutely. We never miss a chance to learn. And honestly speaking, this is something that I really feel deeply about. Some of the people close to me, close friends, have lost um, friends and family to breast cancer, and we still somehow don't talk about it as often as we should. Dr. Saba, how severe do you think is breast cancer in Pakistan?
Breast cancer is the most common cancer in females in Pakistan, and it's so serious that it is coming in younger ages in Pakistan and South Asia. In Western countries, the peak is in 50s, but in our country, the peak is coming in more ages after the 35 years. And one in every nine women can suffer from breast cancer. So the awareness for the breast cancer is very important. Yesterday, I saw a patient who was seeing just 28 years old, and she was seeing multiple gynecologists, and she was having a tumorous lump in her breast. And
Oh, wow.
just because of the lack of the awareness, they present late and the treatment is delayed. So the breast cancer is here, and it's increasing in number. It's the lack of the awareness, and it's presenting in later stages. So early detection is the best time when we should treat the cancer, when the patient should come to us, because and we should educate the community.
Bilkul, I was reading that almost 1 in 4 or 5 women have the
The risk of
right, the risk of developing breast cancer.
breast cancer.
Um, what exactly is breast cancer, though, in strictly scientific terms?
Breast is a gland in our body, and it
Mhm.
functions throughout the menstrual cycle. And under the influence of estrogen and progesterone, there are some changes in our breast. And no, abnormal cells inside the breast, when they get mutated and they become abnormal, they become cancerous cells. And those development is the breast cancer. And when they are able to go into different parts of the body and start damaging our own body, then they are called the breast cancer. And the awareness session with that, the first cancer before becoming spreading into the other parts of the body. They are in the pre-cancer stage. They are in the abnormal cell stage. So that's the best time to pick the cancer. So that's why the education is very important. And the breast cancer uh, uh, is is a cancer. It can be presented as a lump in your breast, any kind of bloody nipple discharge in your breast, any area of hardness in your breast, pain that is was not there before and it's not going away, any lump in the axilla, even it can present in the pregnancy or during lactation also. So any kind of changes in the breast which you feel that that was not before, you must be very much concerned and come to the doctor early.
Thank you, doctor. um, जब हम बात करते हैं breast cancer की, are there any different types of breast cancer?
यस, ब्रेस्ट एक ग्लैंड है और ब्रेस्ट के दो मेन स्ट्रक्चर्स होते हैं, डक्ट्स एंड लोब्यूल्स. The where the milk formation is there, the gland they are called the lobules, and when
जी.
the ducts through the ducts it goes to the nipple and the baby feeds the milk. When the cancer is developed in the lobules, it's called the lobular carcinoma. When it's in the ducts, it's called the ductal carcinoma. Then the cancer present many tumor markers on it. ER, PR receptors, the tumor markers, there are various pathological types of the cancer. And based on those types, we say that this cancer is aggressive type, this cancer is a chemoresponsive type, this cancer is a good cancer, it is more treatable, it has less chances of coming back, it has a poor response to the chemotherapy, it is aggressive, it is more in the younger age. So the cancer is of many types.
ठीक है, I see. When we say कि stage 4 cancer diagnosis हुआ है, what does a stage exactly imply
All
in
right.
any type of cancer, but specifically for breast cancer?
Right. Uh, Stage one, there is a stage zero in which the cancer is in the pre-cancer form, and that's the best time when that's why we say that we cannot prevent the cancer, but we can
Mhm.
pick the cancer early. So that's why we ask women to go for the screening guidelines, to go for the mammography, to go for the ultrasound. So when the abnormal cells are there, it's in the pre-cancerous stage. It's in the ductal carcinoma in situ or the lobular carcinoma in situ when the cancer is only inside the breast and it has not the ability to spread into the body. With the period of time, it gets the ability to go into different parts of the body and spread inside the breast also. Then at stage one is when the cancer is inside the breast, very small lump, and it's not in the axilla. Stage two is when the cancer is of a little big size, but it's not in the axilla, or it may be in the axilla. And stage three is a locally advanced cancer. The cancer is inside the breast and it has also involved the lymphatics and it's present in your armpit. And stage four is when the cancer has spread not only in the breast, in the armpit, but also in some other part of the important of your body, for example, the lungs, the liver, or your bones. And in that part, it's the last stage where the surgery has no role, a lot of not role. Is not going to affect the survival of the patient. The chemotherapy can only slow the progression of the disease, and then the prognosis is very bad. It has only 19% 5 year
I
survival
see.
rate, like uh, only 5 years. सिर्फ 5 साल तक वो सिर्फ 20 to 25% of the patients live for more than 5 years. So the better if you pick the cancer in the early stages. Stage one has more than 90% of 5 year survival rate. Like वो खवातीन जो स्टेज वन और टू पे पिक हो जाती हैं उनके चांसेस हैं कि वो अगले 10 साल तक 80% से ज़्यादा वो जिंदा रहेंगी. उनका नंबर और अगर स्टेज फोर पे पिक होती है तो दे विल बी ओनली अबाउट 19 or 20%. So the better you pick the cancer, the early the stages, the better is the prognosis.
So, excellent segue to my next question, that how frequently should women get themselves checked? And are there any, at home or do it yourself sort of diagnostic techniques that women can use to gauge themselves before they book an appointment with a doctor?
All right. Uh, every time younger females who just soon after their menstrual cycle they should do a self breast examination And we should teach our younger girls that they should do a self breast examination. There are multiple videos on the YouTube available. They can learn and teach themselves how to do a self breast examination after the end of the menstruation, because at that time the breast is not under any hormonal influence, and it's reduced and it's in the normal size shape, and the gland is very shrunken. So the best time is at the end of your menstrual cycle, and for the females who are in menopause, it's any time of the month where they can remember. But it should be only once a month, so that if there are some changes in their breast, they should feel it. Or if you do it frequently, you will not be able to pick any changes in your breast. In the initial, you just to teach yourself, your mind, that how your breast feel like, how every breast is different breast. Maybe some are having a dense breast, some are having small gland, some are having more fatty breast. So you should know what your normal breast is feeling like. And then after that, if you feel any lump, any discharge, any pain in the area that is not going away, any lump in the armpit, then they should go for come to the doctor that it's some abnormal thing. Any dimple on the skin, any nipple which is start getting inside, start becoming inverted. And if you feel these changes, you rush to the doctor, come to the doctor, that why it's happening. And for the females, we say that if they can after 40 they should go for the mammography, because that's the peak time for having and developing the cancer. And the females who have a family history of breast cancer, for example their mother had breast cancer or their sister had the breast cancer, they have a double risk of developing the breast cancer, or their aunt or their cousin is in a younger age having breast cancer. For example, their mother or their sister or the youngest any family member had at the age of 35 they had a cancer. So the screening starts 5 years
Ji.
earlier. So they go into the screening programs earlier because they may be carrying the risk for the developing gene mutation they are carrying or anything. So the self breast examination and screening after 40 years of age with the mammography and ultrasound is very important. Go to your doctor after 40 once a year, and if you carry a risk of having a positive family history of breast cancer, then go 5 years. Start going to visiting your surgeon 5 years before the youngest age of diagnosis of a breast cancer patient.
Thank you, doctor. हमने बात की about detection and diagnostics थोड़ा बहुत. When a woman goes to a doctor to have a mammogram, what should she expect? What are some of the procedures that she should be ready for as she walks into that clinic?
You are talking about a normal person who is going for the screening or having some complaints of the breast
So
lump.
actually, both. So, for example, somebody, if they have a complaint of a breast lump, actually, let's talk about that. Somebody who is feeling a breast lump, what should they expect as the path forward once they go see a doctor?
Okay, this is called a triple assessment, uh, in which they go to the surgeon, and please don't go to the gynecologist because they delay the treatment. Go to a surgeon, or in Pakistan, the surgeons are trained for it. In UK or other countries, the gynecologist also get the breast surgery training, but in Pakistan, they don't get it. So if you are in Pakistan, go to the surgeon and
Ji.
tell them about any complaint you have or anything. They will check you. They will get any your history, that do you have any hormonal intake history, any fertility treatments. They ask for your risk factors, that uh, are you menopausal, or are you uh, uh, and what are the other things in history, for example in family history of breast cancer. They see all those things, and then the doctor will examine you, that how the breast, what are the changes in your breast, and if they pick any abnormality, they advise you to go for the ultrasound or mammography. We send the patient to the radiologist, and then if the patient is younger than 40 years, the mammography is not an effective investigation in those patients because the breast is active. There is a lot of dense tissue which the mammography cannot pick the things in it. After 40, the mammography becomes more effective. So the patient, we can ask the patient to go for the ultrasound or the mammography, and then we see the changes. What is exactly inside happening? Is there a cyst? Is there some cancerous lump inside? Is there a benign lump inside? Is there some other hormonal changes going on, or there's nothing serious going on? So those investigations tell us a lot about what is exactly happening in your breast. And if there is something abnormal we see, then we ask the radiologist, or if there's some palpable lesion, we do it ourselves, the biopsy. The biopsy is very important because it gives you the 100% with the surety that what is exactly happening. It is a benign thing, or it's a cancer, or these three things you should expect. The first, the surgeon will see you, then we advise the investigation, and if there is some abnormal area, we ask for the biopsy. And never be afraid of getting a biopsy done because it's very important, and that's the 100% surety that we can tell you as a doctor that is it an inflammation, is it a pus, is it a benign lump, is it a malignant lesion. So you can expect that, and then we treat them accordingly. If the cancer is there, obviously, then the tumor markers and staging will start. If it's a benign lesion, then we'll ask for the lumpectomy or the treatment, or if the infection is there, we ask for then antibiotics and whatever the case is.
ठीक है that was actually very informative. Before we move on, there is some distortion आपकी mic की तरफ से, so perhaps if you could move, yeah, exactly, perfect. So आपने mention किया कि अगर if it does come out to be positive for cancer, could you perhaps shed some light कि let's say खुदा न खास्ता somebody comes and their biopsy comes back and you know for sure that they have breast cancer. Now what happens?
Okay, then uh, then we will advise for the tumor markers. Then we
Mhm.
see what is the size of the lump, and then we order for the tumor markers. Then we do the metastatic workup, that what is the stage of the cancer. We go for the chest x-ray, ultrasound, or the CT scan and bone scan, or in some cases PET scan. So we know that if the cancer is only inside the breast, or it's inside it has spread to the other parts of the body or not. Usually at the time of diagnosis, the women are in stage 1, 2, or 3. It's very rare these days they come to us with stage 4, only if they
Mhm.
ignore the things a lot. For if the guilt is there from last 1 year, then they will come to us in stage 4. So when the tumor marker results will come, and then we will see that what kind of tumor it is. It is a hormone responsive tumor. Is it a chemotherapy responsive tumor? Because the prognosis and the treatment depends on that. And then the team of the a team of a team will sit, in which an oncologist will also come. Oncologist will decide, and depending on the patient age and the condition, physiological condition of the patient, हम decide करते हैं कि अभी हमने पहले सर्जरी करनी है, या पहले हमने कीमोथेरेपी की तरफ जाना है, ट्यूमर को श्रिंक करना है, और रेडिएशंस देनी है, ब्रेस्ट को बचाना है, कोई उनको प्लास्टिक सर्जरी करनी है। तो जिस तरह का मरीज जिस स्टेज में प्रेजेंट करता है, डिफरेंट टू डिफरेंट वेरी करता है। मोस्टली विद द नाउ विद द ऑन्कोप्लास्टिक ब्रेस्ट सर्जरी, मोस्टली अब वो वाली चीज़ नहीं है जैसे आज से 15-20 साल पहले ब्रेस्ट को रिमूव कर देते थे। ऐसी कोई ज़रूरत नहीं है अब, बिकॉज नाउ वी आर एबल टू सेव द ब्रेस्ट, एंड इन द लॉन्ग टर्म इट द स्टडीज हैव शोन दैट whether you remove the lump or you remove the breast, it is not going to affect the survival of the patient, and it's not going to affect the disease progression of the patient. So now we go for, and even अब अगर बगल में आपका कैंसर नहीं गया हुआ, we go for the sentinel lymph node biopsy. और अगर उसमें lymph nodes में कैंसर नहीं आता, तो we don't go for the axillary dissection, बगल की सर्जरी भी नहीं करते. That saves the patient from a lot of pain afterwards. Comorbidity will be lesser, and then it's a 6 to 8 months treatment, and Then the radiations can happen
Mhm.
also. They go for under the radiations therapy sessions, and after 6 to 8 months treatment, they are fully free of cancer because it's a curable cancer if picked early. The patient will be absolutely fine. The side effects of the chemotherapy will go away eventually with time. And if you are picked, even if locally advanced cancers can be downstage easily. Uh, so the thing is that don't get scared of the treatment. The treatment is more not aggressive than the disease itself. Come to your doctor. Don't get scared. Get the treatment. It's a curable cancer and it has a very good 5 year survival rate. You will be free of cancer and the prognosis is good.
That's actually a very hopeful note to have. Um, how long is you? And I know that probably this varies person to person, but usually, how long does a regular chemo and then no more lapse of relapse of cancer? How long does this process of healing usually take?
Chemotherapy sessions take about 4 to 5 months. The surgery is done in one day. The recovery will happen in 2 weeks, and then the
Mhm.
radiation therapy sessions, if needed, they can happen for 1 month. So the treatment, the total duration of the treatment till stage three is about 6 to 8 months, and after that, the patient is only for the follow up to know that it's not if they follow up so that we will be sure that the cancer is not coming back.
Mhm.
Some cancers are good that they don't come back. Some cancers are bad. They have the tendency of recurrence. So we keep the follow up for the patient for till 5 years. We ask the patient to come for three after 3 months, after 6 months, then after every year, so that if there is cancer coming back, we could be able to help the patient in the early stage and treat it if it's there. So this is how it's 6 to 8 months is the treatment.
Okay, good. So I am a daughter of two doctors, and we grew up listening to people talk in some foreign language, and they communicated with each other that way. And then sometimes still we have to tell my ammi ki, "Ammi, please, in layman English, समझाइए कि क्या बात है." So
Mhm.
I believe that you were very, very clear so far in everything that we spoke of. Very eloquent and very, very मतलब when you say कि घबराए नहीं and get it checked, it's actually amazing to hear that from a doctor that get
Mhm.
yourself checked. It's fine. It's not worse than the disease in itself. Which brings me to some of the weird things that we have in our culture. जैसे बहुत सारी चीजों के साथ बड़ी जल्दी myths associate हो जाती हैं. What are some of the myths that you would like to debunk in this session regarding breast cancer?
Let's एक ये कि बायोप्सी करने से कैंसर फैलता है. People are afraid of getting the biopsy of their lump done. So
Mhm,
बायोप्सी करने से कैंसर नहीं फैलता. बायोप्सी अगर आप नहीं करवाएंगी तो कैंसर लेटर स्टेज में जाके फिर भी डायग्नोस होगा. तो बायोप्सी आप करने से कैंसर नहीं फैलता. बायोप्सी नीडल लगने से कैंसर नॉर्मल गिल्टी कैंसर में नहीं बदलती. तो डोंट बी स्केयर्ड ऑफ द बायोप्सी. This biopsy myth is a nightmare for me because the patients will come, they will get checked, and when I ask them, I don't think this lump is good, or even if it's good, I want to be 100% sure because
mhm,
sometimes the cancer lump may look like they are not dangerous, but they are dangerous. They may present as a benign lump. So I ask the patient to go for the biopsy and they run away. So don't get scared of the biopsy and get the biopsy done. Number two myth is that if your family in your family अगर आपकी family में breast cancer है तो you are not 100% going to get the breast cancer. And if आपकी family में breast cancer नहीं है तो it doesn't mean that you cannot have the breast cancer. So ये बहुत अगर आपने स्क्रीनिंग प्रोग्राम में आना ही आना है, आपने 40 साल के बाद मेमोग्राफी करानी है, अगर आपकी फैमिली में ब्रेस्ट कैंसर नहीं भी है तब भी करानी है. तो क्योंकि 80% newly diagnosed breast cancer patients don't have any family history. So it's very important that you do your self breast examination. you keep your weight in normal range. Your BMI should be within the normal range. You do a 30 to 40 minutes exercise every day, and have a plant-based diet. So this should be the message that uh, and the breast cancer is not contagious. It doesn't spread from one person to other person,
Hmm.
and and they are wearing bra or not wearing bra has no link with it, and these are the myths. Any other myths you can discuss with me?
So again, growing up in a doctor's household, we didn't have any access to myths. We had access to cold hard facts, and that's why I truly get scared when people say some very empirical things that don't have a basis in fact. That's why I really wanted to bring this conversation here as well, ताकि ज़्यादा से ज़्यादा लोगों को पता चले कि ऐसी कोई बात नहीं होती है, आप बस ऐसे ही डर रहे हैं कुछ चीज़ों से. Definitely get. Please continue.
एक और चीज, हाँ, lump की कोई medicine नहीं होती. If you have a breast lump, इसकी the people ask if they give some medicine. The homeopaths and hakims, they only delay the treatment, and the quacks don't go for any other things like that. Uh, uh, there's no medicine for lump. If the lump is there, you have to investigate it, and uh, that's what there is another myth I remember.
No, this is brilliant, absolutely, because I do know for a fact that a lot of people are scared for operative diagnostic procedures, and it's good to know that it's okay. It's not
Yeah,
something you should be scared of. Thank you so much, Dr. Sadaf. Thank you so much for everyone who tuned in to watch this. I will be circulating this video far and wide through social media and our different portals as well. Should anyone have any questions, please feel free to write to us, and we'll be sure to get your questions to the esteemed doctor. Definitely make it a point, should you be in Lahore, definitely make it a point to please visit Dr. Sadaf at the One Stop Breast Clinic, both at Shalimar Hospital as well as at the Chughtai Lab Center. Um, all other specialists at the Chughtai Labs are available, and appointments can be booked on with the Chughtai Lab specialist on the number that is being streamed right now in the strip below your screen. Definitely get in touch with the doctor and do not be scared. Early diagnosis can lead to early recoveries and treatments as well. Once again, thank you so much, Dr. Sadaf. It was absolutely a pleasure to have you. आपने कुछ बहुत ज़्यादा अच्छी बातें बताई. Should anyone have any questions, I would be sure to get those questions to you. Thank you.
thank you.